Hi, my name is Kimberly Trammell. I am a graduate family nurse practitioner student at Maryville University. And today I have joining me my daughter, Taylor Trammell. She's a 17-year-old African-American female who's going to be my patient today for an eyes, ears, nose, throat, and mouth exam. I've already come into the room, I've introduced myself, I've done hand hygiene, and we're gonna just jump right into this. Hi, Taylor. We're going to start your eye exam with the Snellen chart. I'm going to stand about 6 feet away from you, and I want you to read to me the line starting from the bottom that is clearest to you.
F, D, P, L, T, C, E, O.
Okay, and can you cover your right eye?
F, D, P, L, T, C, E, O.
And cover your left eye?
F, D, P, L, T, C, E, O.
Okay. No abnormal findings with the Snellen chart. Snellen test, Taylor read at 20/20, which is she sees at 20 feet whatever the majority of the population would see at 20 feet. All right, I'm going to do a visual inspection of your eyes. Her eyebrows seem to be, her hairs are evenly dispersed, her eyelids are symmetrical, her eyebrows are symmetrical, her eyelids, her upper lid hairs are going up, and her lower eyelids are going down. Don't see any signs of infection. Her sclera is nice and white. Her iris are browns. Her pupils seem to be about 3 millimeters in size. Her conjunctiva seems to be clear, nice and pink. Look up, thank you. No signs of infections or foreign bodies or any type of discharge. I'm going to use my pen light. I'm going to shine a light in your eyes. If you need a break, just let me know if it's too much light. All right, I'm going to look at this eye. All right, right here at my nose. All right, her pupils are equal in size, reactive, and accommodating. All right, now I'm going to have you look at my, I'm going to have you look at my nose, and we're going to test your cranial nerves, your optic nerves, 3, 4, and 6. Right here. And now follow my finger. There we go. Perfect. No abnormal findings. She was able to move her eyes in all the different directions, and then when I brought my finger in closer to her nose, her eyes converged appropriately. Okay, now we're going to do this exam. Put your hand above your eyes, and I want you to let me know we're testing your peripheral when you can see my finger.
I can see it. I can see it. I can see it. I can see it.
Let's do it with the other eye. There you go.
I can see it. I can see it. I can see it.
All right, perfect. So no abnormal findings in her peripheral field of view exam. All right. I'm going to take this light. I'm going to look a little bit further into your eyes. I want to see your red reflex. It's okay if you have to crawl. There you go. All right, we're going to look for, I'm going to stand about a foot away and look for a red reflex in your eye. Just look right here at the tip of my nose. There you go. And red reflex was noticed in both. I'm going to get a little bit closer. We're going to look at your blood supply in your eyes, and we're also going to look at your optic disc. All right, just gonna have you look a little bit, just gonna look over my shoulder. Perfect. Just gonna touch your chin if that's okay.
Mm-hmm.
All right. Yes. I see a yellow optic disc, and I would do the same thing on the other side. Her blood supply looked fine. No issues with the veins or venules inside her eyes as far as clotting or disorders. All right, now I'm going to do a physical exam. So I'm going to touch your face. I'm going to feel your glands. Looking for your lacrimal glands. No obvious nodules. Whole orbits feel fine. Bones and joints are together and in shape. You feel any pain or discomfort with this?
Mm-mm.
All right. Looking again at the conjunctiva, no signs of styes or anything. Again, the hairs and eyes look great. All right, I'm gonna also, while we're at it, I'm gonna do your sinus exam. I'm gonna put a little pressure here. Tell me if you feel any discomfort while I'm pressing. Any discomfort?
That's fine.
All right, I'm gonna put a little pressure right here. Any discomfort while I'm doing your frontal and maxillary sinuses?
No.
All righty. Let's see. So that concludes your eye exam. Now let's move over to your ears. And doing a visual inspection, our ears seem symmetrical, nothing obvious, no discharge, no excessive ceramin, no keloids or no excessive growth. I'm gonna pull your ears right there, palpate, nothing. Any discomfort with that? All right. I'm gonna take my scope, I'm gonna look in your ear. I'm gonna pull pin it back, look in. Her canal is clear, very minimum ceramin, barely hardly any. Her tympanic disc in the back is nice and a pearly gray and clear. No signs of infection, bubbles. Doesn't look like, I know her history, so she doesn't have any ear tubes or anything. And I would do the same for the opposite ear. We're gonna do a whine and rubber test. I'm gonna take this, I'm gonna tap it, I'm gonna put it on top of your head. Let me know if you hear it evenly in both your right and your left ear, or if you hear it more in one or the other. Ready?
I hear it.
Evenly in both the ears, or? Okay. All right, the next thing we're gonna do, I'm gonna take this, I'm gonna tap it. I'm gonna put it right here close to your ear. Let me know when you no longer hear the sound, and then I'm gonna move it and you let me know if you hear it when you stop hearing that sound.
I don't hear it anymore. I don't hear it anymore.
Okay, so bone conduction was approximately 3 seconds, whereas her air conduction was about 6 seconds, which is double what you're supposed to get, and that's a normal finding. No glands or nodules or lymph nodes or anything palpable on her ear exam. I've been talking to her this whole time. She's been responding. No signs of difficulty hearing. We're going to do a quick whisper exam.
Johnny loves red cars.
Okay, and so she's passed the whisper exam. Again, nothing to cue or sign that she would have any issues with her hearing. All right, so that concludes our hearing exam. We're going to go into our nasal exam. Her nasal cavity, her nose looks to be symmetrical with her face, no signs of trauma or injury. I'm going to palpate for any dislocated bones. Do you feel any discomfort while I'm doing that? I'm going to check your nasal patency. Can you breathe? All right, I'm going to have you tilt your head upward. I'm going to shine this light up in your nose and just kind of look to see. Her nasal passages are both clear, nice and pink, some little hair, minor mucosa on this side. But other than that, clear passageways, no excessive mucus or anything or discharge. All right, so now we're gonna move to her mouth. Her lips and her skin looks to be in healthy condition, no cracks or lesions or anything that would indicate dryness, excessiveness, no bleeding from her mouth, no sores, open sores. Her skin color, it seems to be in line with her ethnicity. I'm gonna have you open your mouth and tilt your head up a little bit so you can see. All right, top of her palate seems nice and even. Her teeth, her dentals, no obvious caries. I'm gonna have you, can you stick your tongue out and say ah? Uvula is nice and midline, no red infection, pustules, excessive discharge. Can you move your tongue side to side? And test that cranial nerve 12. There you go, and take the top of your tongue to the top of your mouth. It looks nice and clear. Blood vessels look nice and pink. No open sores, caries, or lesions. Teeth look fine. In your inner lip. Her gum line is nice and pink. No signs of gingivitis or anything. Okay, let's see. And we've done your mouth, and I think that concludes our exam.